So let's start with the basics. Your kidneys are two bean-shaped organs, each about the size of your fist, located in your back just below the rib cage. They filter waste from your blood, regulate blood pressure, and balance electrolytes. Kidney cancer happens when cells inside the kidney grow out of control, forming a malignant tumor. Now, most kidney cancers are what's called renal cell carcinoma, or RCC for short. This type makes up about 90% of all kidney cancers. Within RCC, there are subtypes. Clear cell is the most common, followed by papillary and chromophobe. Each behaves a little differently, but clear cell tends to be the most aggressive. There are also other less common kidney cancers like transitional cell carcinoma, which starts in the lining of the renal pelvis, and Wilms tumor, which mostly affects children. But when people say kidney cancer, they're usually talking about renal cell carcinoma. One interesting thing about kidney cancer is that in many cases, it's found by accident. These days, lots of people get CT scans or ultrasounds for other reasons, like back pain or abdominal issues, and a small kidney tumor is discovered. That means many kidney cancers are caught before symptoms even appear. Now let's talk about risk factors. Smoking is one of the strongest. Smokers have about double the risk of non-smokers. Obesity is another. Excess body weight changes hormone levels and increases inflammation, which contributes to cancer risk. High blood pressure or hypertension has also been linked. People with chronic kidney disease, especially those on long-term dialysis, are at higher risk. A family history of kidney cancer or certain inherited conditions like von Hippel-Lindau disease can also increase risk. Long-term exposure to certain workplace chemicals like trichloroethylene has been implicated as well. And being male is another factor. Men are about twice as likely as women to develop kidney cancer. Age plays a role too, with most cases diagnosed after 60. All right, let's move into signs and symptoms. The classic triad of kidney cancer symptoms is blood in the urine, flank pain, and a palpable mass in the abdomen. But here's the catch. This triad is only present in a minority of patients, especially in early stages. The most common symptom is actually hematuria, or blood in the urine. This may be visible to the eye, turning urine pink or cola-colored, or it may be microscopic and only detected on lab tests. Other symptoms include persistent pain in the side or back, a lump or swelling in the abdomen, and unexplained weight loss. Fatigue and fever without infection can occur. High blood pressure may develop or worsen because kidney tumors can produce hormones that raise blood pressure. Some patients also develop anemia from blood loss, or paradoxically, too many red blood cells, because the tumor produces excess erythropoietin, the hormone that stimulates red cell production. In advanced disease, symptoms can include bone pain, cough, or shortness of breath if the cancer has spread. So why do these symptoms happen? Blood in the urine occurs because the tumor invades tiny blood vessels inside the kidney. Flank pain happens when the tumor stretches the kidney capsule or presses on nearby structures. Weight loss and fatigue are typical of many cancers. They result from changes in metabolism and energy use. High blood pressure can be from overproduction of renin, a hormone made by the kidney. And when kidney cancer spreads, symptoms depend on the site, like bone pain from metastasis to the skeleton or cough from lung involvement. If you're finding this helpful so far, please hit the like button and subscribe. It really helps us keep producing these clear, practical lessons for both students and everyday viewers. Now let's go into diagnosis. If kidney cancer is suspected, imaging is the main tool. Ultrasound may detect a mass, but CT scan with contrast is the gold standard. MRI is used when CT isn't possible, like in patients with kidney problems who can't get contrast dye. Imaging not only shows the tumor, but also whether it has invaded nearby veins, like the renal vein or even the inferior vena cava, a large vein carrying blood to the heart. That's a unique feature of kidney cancer. It sometimes grows into veins like a vine creeping into pipes. Biopsy isn't always necessary for diagnosis because imaging can be very characteristic, but it may be done if there's uncertainty or if the patient isn't a surgical candidate. And treatment decisions depend on knowing the exact type. Blood and urine tests are also done to check kidney function, look for anemia, or detect abnormal hormone levels. Staging is based on tumor size, involvement of lymph nodes, and spread to other organs, most commonly the lungs, bones, liver, and brain. Now on to treatment. Surgery is the cornerstone for localized kidney cancer. If the tumor is small and confined, surgeons often perform a partial nephrectomy, which means removing just the tumor and leaving the rest of the kidney intact. This helps preserve kidney function. For larger tumors, a radical nephrectomy may be needed, where the entire kidney, surrounding fat, and sometimes nearby lymph nodes are removed. Minimally invasive techniques like laparoscopic or robotic surgery are common today. For patients who can't undergo surgery due to other health issues, ablation techniques like cryotherapy, freezing the tumor, or radiofrequency ablation, burning the tumor with heat, are options, especially for small cancers. For advanced or metastatic kidney cancer, treatment has changed dramatically over the past 10 to 15 years. Traditional chemotherapy doesn't work well for kidney cancer, but targeted therapies and immunotherapies have made a huge difference. Targeted drugs like tyrosine kinase inhibitors, examples include sunitinib, pazopanib, and cabozantinib, block signals that tumors use to grow new blood vessels. These drugs can shrink tumors and slow progression. Immunotherapy has been a game changer. Drugs called immune checkpoint inhibitors, like nivolumab and pembrolizumab, unleash the body's immune system to attack the cancer. Often, targeted therapy and immunotherapy are used in combination. These treatments have significantly improved survival for patients with advanced kidney cancer. Radiation therapy is not very effective for kidney cancer itself, but it may be used to relieve symptoms from metastases like bone pain. Now let's talk about side effects. Surgery can cause bleeding, infection, or reduced kidney function, especially if one kidney is removed. Targeted therapies can cause fatigue, diarrhea, high blood pressure, and skin rashes. Immunotherapy can cause inflammation in organs like the lungs, thyroid, or liver, because the immune system sometimes attacks normal tissues. That's why careful monitoring is crucial. Let's take a moment to talk about prognosis. For kidney cancer confined to the kidney, outcomes are generally good. 5-year survival rates are over 90% for small tumors that are surgically removed, but survival drops significantly if the cancer spreads to lymph nodes or distant organs. That said, new treatments have extended survival times in advanced cases, and many patients live much longer today than in the past. Globally, kidney cancer rates are highest in developed countries, partly because of lifestyle factors like smoking and obesity, and partly because imaging is more common, which leads to more incidental findings. Public health measures like smoking cessation, maintaining a healthy weight, controlling blood pressure, and avoiding harmful chemical exposures can all help reduce risk. So, final thoughts. Kidney cancer is often silent in the early stages and may be found by accident. Classic symptoms like blood in the urine or flank pain usually mean the disease has progressed, so awareness and regular checkups are important. Surgery is the best chance for cure when the cancer is localized, while targeted therapy and immunotherapy are powerful tools for advanced disease. And as treatments continue to improve, outcomes are getting better every year. And that wraps up our lesson on kidney cancer. If you learned something new today, share this video with someone who might benefit, and I'll see you in the next one.